Hi there, David here from Bodyworks DW. This is Hannah. She's a fabulous massage therapist in her own right and is a wonderful member of our team. I want to do an example of what an actual set of intake, treatment, outtake, follow-up looks like with a real client. And so I want this intake, unlike some of my webinars, to be very concise, to really get everything I might need from a new client in the first session without trying to get every little detail possible, so that I have enough information to craft a really good first session, but I'm not delaying the time that it takes to get them on the table to the point where they're really missing out on noticeable amounts of table time, right? And so it's a little bit of an art form, right? And the sweet spot is around 5 to 8 minutes to get enough information to really do something. If you do too little and you just throw them on the table, you might accidentally do the right things, but you're not really going to know what their issues really are. And if you try to get everything and do way too much, again, you're not going to get them on the table quickly enough, and you run the risk of them being unhappy because you cut their session short. So, how are you? This would be the classic question I open with almost every client. What brings you in today?
Yeah, so I'm having issues with my neck movement. I have shoulder pain, and then specifically on the right side, on the lower back, I have pain back here, and I think that's from how I'm standing when I do massage.
All right, so the first thing you do is listen and then repeat back. So I hear that you've got some neck pain, and honestly, just having you sit here, you won't see this on camera, but you will see it when we put her into a body reading position. Your head does actually tilt slightly towards the right at the AO joint level. And that might be actually contributing to the low back pain that you mentioned on the right side, or the right side low back pain might be contributing up there. We don't know which one came first, but we can interrelate those things. So the next question, follow-up question, would be something to the effect of, is it sharp? Is it achy? Is it chronically all the time, or only intermittent with certain activities?
Yeah, it's not sharp. I would say more sore, and I think it happens it's normally after a long day of massaging, or when I have to sit in odd positions for a long period of time.
Great. And on a scale of 1 to 10, like how bad does the pain get if a 10 was unbearable?
Like a 6, I would
say.
say.
A 6, okay. 6 is not anything to sneeze at. Okay. Great. So anything else that you can think of? How are knees, ankles, feet, jaw, anything else going on that might not be showing up today but does bother you from time to time?
Yeah, I also, I'm learning aerial silks.
Uh-huh.
I have to hold my body weight like this a lot and pull myself up. So I think sometimes the lats.
Yeah, totally. So that certainly would contribute to some low back pain and potentially load up more on one shoulder or the other. Nothing going on with feet and ankles or knees?
Today they're doing pretty good.
Today, what about not today?
So I've sprained the left ankle about 3 times.
Great.
So it's a little overly flexible. So after being on my feet all day, I'll accidentally start standing like this, and then I'll get a little bit of pain around the joint. It's not, I've been trying to fix that, so it's not happening too much.
Right. So that totally, to me, would be source material for the low back on the right, right? And we'll look at that. And so you could get tempted at this point where now, I don't know exactly how many I've talked and done intake, so cut the time I've just spent in half, let's say. But even there, we're probably 3 or 4 minutes in, right? I could get more detailed, but I've got enough to start to do a body reading, right? I know that your main issues are your neck and your back, and I've repeated them back, and she's confirmed, yep, that's right, you heard me correctly. I've also identified a potential root cause that's seemingly unrelated or not bothering her right now, but that I can through experience, know that like this might not be the thing we work on today, but in session 2 or 3 is going to start to matter. So at this point in an intake, I would switch to doing postural analysis to confirm some of the things that I'm seeing. So what I would do with a client is sort of back up a little bit and just ask them to stand up and take off their socks and shoes, which I'm going to have you do right now on camera. And then we're going to change angle and have you stand facing front. So I just want you to see in the treatment room, I would not ask them to do some wacky movement. I would literally just make space for them and have them stand up right from the chair that they were sitting in, right? I want to make it easy on them. I don't want them to feel like they have to walk all over the place, right? For me, this is all I need from the client. Now, I want you to stand comfortably, not trying to be perfect. Let your arms hang. Some clients will put their arms in their pockets or like at their sides, and I do want to see what it's like with the arm hang. And so now I would stand there and I'm gonna point out the things that I see that mean different things to me, and I want to make sure as I'm doing that, that I'm not just doing it all in my head, that I'm talking to the client, that I'm keeping eye contact with them, and that I'm not just having them feel like some weird, doll that's like not an actual person, right? Like some object. I want them to, I want to maintain a relationship and not just treat them like an object, right? The first thing I look at is the foot position. Her feet are very, very close to a perfect neutral, which is unusual for a dancer, honestly. But I will point out a couple very subtle small things, and I would call them out to you. There's a very slight, very, very subtle external rotation, barely there. But this left foot is about 1 millimeter to 2 millimeters behind the right foot, which is actually drawing this hip a little bit more forward, which is then requiring the ribs to counterbalance a little bit that way, which is gonna absolutely pile up over here in the right QL. And that head tilt that I saw with her sitting, you should now see on camera very cleanly that right here at the AO level, there's a very slight tilt of the head there. All of that is very subtle on Hannah. A lot of clients will be much more misaligned and in noticeable ways. Now, when I'm talking to a client, I just want to point out the major things that I see. I also want to relate like why they matter to me, right? So that left foot being slightly behind is certainly probably related to your old ankle injury, and it is causing a pelvic tilt that is absolutely hiking up the right hip, which would certainly explain your low back pain, right? And for some reason your head tilts along with that. We're not quite sure why yet. Now, I want you to turn towards the side. Now, when I'm doing a quicker intake like this, I don't usually do all 4 sides. I'll do front and one side or the other in general because I don't need to get every tiny little detail. But here, we absolutely can see a slight anterior tilt of the pelvis, a slight back bend here of the rib cage coming back, a slight head forward thing there. And really the major thing, if anything at all stands out, is the fact that her arm hang is not straight down, but actually at an angle, which could be, I'm a new massage therapist, overusing my biceps a lot. That might be why my shoulders are ending up at my ears by the end of the day. Come back, face the camera again. Now, that's, again, if you cut in half all the explanations and just think about what I actually told her, we're sort of 5 minutes in, maybe 6, even with the explanations, right? I've now got enough information to craft a treatment. And my treatment is going to be a little asymmetrical. I have a few options here. So that this is the last piece of the puzzle before I put them on the table. Of the 2 issues that you mentioned, your neck and your back, which one's most important to you to feel better today?
Back.
Your back, okay. That's meaningful. Had she told me her neck, I would change my treatment plan. But she wants her back to feel better. That's the most important thing. So Given that, I have a few options. I could start her face down like you always almost do when you think of doing somebody's back. However, I'm going to challenge your thinking and do just face up to deal with this today. But my goal is going to be to get that ankle moving a little bit better, deal with this pelvic rotation and get it more neutral so that that will allow the right hip to drop down and open up the lumbar region, and then finish with some neck work and up top to have the neck also feeling better. How does that sound to you?
Sounds great.
Great. And that's another piece. You want to then present a brief but concise plan and then ask the client, are they enrolled in it? Do they want to do that? And some clients might say, yes, but you know what? I forgot that my arm's hurting, right? And then I might say, okay, how important is that? Do I need to alter things? Maybe I don't. Maybe I just spend a little extra time on that in session and that's enough to satisfy them. But I do want to check in and make sure that my plan actually sounds good to you. Okay? So now that I've got agreement on the plan, I can then say to the client, great, I've got a great plan for you. We're going to go face up today. I'll point at the table and literally be like, this is where this goes, this is where that goes. I'm going to turn off the overheads because you're going to be face up and I don't want you staring right at the lights. I'm going to leave, let you get on the table, and I'll be back in like 2 to 3 minutes and we'll get started when I knock on the door. And that's a full intake. So now if you cut out all my explanations, I guarantee you that was at least under 10 minutes, maybe under 8, which is around the sweet spot where now I've got roughly 55 to 60 minutes for full table treatment, or 90 if they're on a 90-minute, and still an extra 5 minutes at the end to do outtake and a little checkout.